October is Breast Cancer Awareness Month, so it would be right that we do a video on breast cancer, telling you what predisposes you to breast cancer, how to know if you're at risk, how to prevent it. Yeah, and we have Dr. Lucy back on the channel. You remember her from the feminine hygiene video.
Hi, my name is Lucy Nanunji. I'm a medical clinical officer and a health educator with a female sexual and reproductive health, branded as Mukazi Wellness on Instagram and on YouTube.
Yeah, so you know that this is going to be a really, really dope and informative video. So even before we go any further, if you're not yet subscribed, please subscribe, join the Sunshine community, and let's get into it. So, Dr. Lucy, first of all, tell us, what is breast cancer and who can get breast cancer?
So breast cancer is an overgrowth of the tissue in the breast. When the tissue is overly exposed to a hormone called estrogen. Now we're going to briefly go through the menstrual cycle. The menstrual cycle has two phases. The early phase, which has the time when you're menstruating, and the second phase of that early phase is the follicular phase. The second phase is the days that lead to ovulation.
So while the egg is maturing and getting ready to be released. Yeah.
Now in that first phase, the dominant hormone is estrogen. Then at ovulation, estrogen peaks and it alerts the brain, and another hormone called luteinizing hormone is produced for the egg to burst out. We get the egg. Then in the after ovulation, we'll go into the second phase. The second phase, that's when the uterus is being prepared to receive the egg. The brain thinks that each month we are going to get pregnant. So the uterus is being prepared to receive a fertilized egg. So if the egg is not fertilized, the levels of the progesterone will go low and we'll have a period. If the egg is fertilized, progesterone will continue to be produced. It will go up. Then we shall continue with the pregnancy sustained. So where does breast cancer come in? Breast cancer comes in, we are focusing on this particular hormone, estrogen, because it's the culprit here. So where do we get our estrogen? Estrogen is produced from the uterus, but majorly the fat cell in the body.
The fat cells
favor the production of estrogen. So when you asked what's breast cancer, overgrowth of the breast tissue. Yes.
And that tissue is exposed to estrogen.
To high levels of estrogen. Then who is at the risk of getting it? People who are female and people who have estrogen in their bodies. So also men have levels of estrogen, but they are just lower than those that women have.
Okay.
Yes.
So you've had it. Men can also get breast cancer.
Yes, men can also get breast cancer. Then the other things that predispose us to getting the breast cancer, there's smoking, if you are a smoker, or if you're exposed to the tobacco.
What about there's shisha, there's vaping?
All those brands of tobacco, though marketing brings them in flavors, and also we are fooled by the marketing. So you can be doing
shisha, but there's tobacco.
Yes, you are predominantly taking in tobacco. This is just a flavor that's masking the tobacco.
Okay.
Yes.
Wow.
So also exposure to the false estrogens in the environment. So the false estrogens are in perfumed products, the artificial perfumes, overexposure. So
there's no perfumes that
Yes, the perfumes we are doing perfume. You perfume yourself in the air freshener, in the car, in the bathroom, then the diffusers with artificial.
They have estrogen.
Okay, when the body takes in the artificial perfume, it has the formula. You remember those formulas in chemistry? Yes, it has the same formula as that of estrogen that the body produces. So when it enters the body, overexposure. I will not say when it enters.
What is overexposure?
The overexposure is what you have talked about recently. Like you have sprayed yourself deodorant, perfume, and body spray, body splash.
Then you have a scent in your car.
There's a scent in the car.
And in the
There's
house.
a scent in a diffuser running 24/7 in the house. There's a scented candle that's finding you when you come back. Then in the toilet, there's one that's running 24/7. So that's the overexposure. Then the other false estrogens are in the plastics that we use. So we are using plastic for hot cup of tea. You're using it for, like, when you finished boiling, maybe the pako is plastic. So overexposure to the plastic. When you buy out your
ice cream containers to store your food and pack it.
Yeah, the hot things, we are using them in the microwave. Yeah, so that overexposure to the plastic. But then also, on the other side, we can limit the exposure to these things because we cannot do away with perfumes.
So now, how do we limit perfume usage? Because I love perfume. I'm just wondering.
So on the perfume usage, you can decide to bring in essential oils on the diffusing part of it for the house to smell nice. Or
What about these ones that we put on our body?
The ones that we put on our bodies, you just limit exposure. But then there are things you can do to help your body to excrete these false estrogens before before they do you harm. So that's where we go into the nutrition part of it.
Okay, we shall get into that one a bit later.
Yeah.
Okay.
So on the plastic part, we can opt to preserve the plastic, to use them for things that are not hot. So we can limit out on the amount of the false estrogens that are melting into our food.
Okay. What about if plastics are BPA free? Is that the safe plastic?
BPA free is the safe plastic, but BP has a whole range. There's BPA, BPB up to, it's like a spectrum.
Okay.
So since we are constantly using the plastic, we have to just be aware to limit its usage with the hot things.
Okay.
So if you're ordering your coffee, you tell the lady not to put the plastic cup, to just give it to you without the
glass or the paper cup.
Tell her leave out the paper cup, so you just get the glass. When you finished boiling your water, before you put it in the plastic jerry cans or anything, you wait for it to cool in the steel saucepan, then you transfer it there.
Okay.
If you're making the baby's milk or things, you opt for the steel and the glass to cool, then you transfer into the bottle.
Okay.
Yes.
Wow.
So then for the perfume, again, like you said, if the air fresheners for the toilet, we can choose to go with the spray compared to this one that runs 24/7. So
you just spray once, freshen the air, and
then you move away. Because we can't do 100% away from these things, but we can limit our exposure to them.
Okay. Wow. Right? The video can end here. So I recently did a reel on checking your titties. Go to Instagram if you don't follow me and watch it. So how should someone do a self-breast exam? And when should we do it? Can we do it at any point in our cycle, and then also for the men?
So when we talk self-breast exam, it is self. You are doing it on yourself. But then there's an option of where you find something, and when you found it, then you go to the hospital. They will repeat it. So when your healthcare provider is telling you they're going to touch your breast and examine it, don't be so alarmed. So what are we looking out for in this exam? We are looking for lumps, but also we are looking for a discharge from the nipple. Then we are also looking for, like, you're observing the shape of the nipple
and the hardness or softness of it.
But we're also looking at the skin. How is the skin behaving? So in doing a self-breast exam, you stand before a mirror without a bra. So you're facing the mirror. But when at the time of the menstrual cycle, after your periods, a few days after your periods,
is when we should check.
Yes, because then most of the hormones are low, And estrogen in particular is just starting to rise.
Okay. So it's still low.
It is still low.
Okay.
So you stand before the mirror. When you stand before the mirror, you first raise your hands. So when you raise your hands, naturally the breast tissues go up.
Go up?
Yeah. So when you try to raise your hands and nothing is going up, you first don't be in a panic. You take caution. Then you observe the skin. Is there anything like a dimple? How is the skin? Is it looking like the peel of an orange, or is it looking normal? Then you look at there are some wrinklings that may appear. Are the wrinklings normal? Because at times you have breastfed and the breast is falling. And there's
so when you put it up, it wrinkles.
When you put it up, it kind of wrinkles.
Yeah.
So is it natural wrinkles? At times, if it's natural, it's just to reassure yourself and we move on. Yes. So after observing that, we go into the exam. So you raise your hand.
All the way.
Yeah, you go all the way up. Then you start from the armpit.
Some lumps can be in the
because
armpit.
breast tissue goes up to the armpit.
Okay.
Yeah, so you come feeling in a circular motion.
Using these 3 fingers.
Gentle circular motion. Yeah, so you feel and feel and feel. When you finish the armpit, you come, then you go round the breast. When you finish going round the breast, you come on the nipple and you press like this for any discharge.
So what's the dangerous discharge?
Why we say to press for any discharge, and immediately after the period, you have to also ascertain that you are not breastfeeding, because if you're breastfeeding or you've recently been breastfeeding, there will be a discharge. Milk will come. So the discharge is watery, as if, how do I say?
Milky water.
There is not milky water, tending towards brownish. Yes, but at times if the discharge is there and you've also felt something like a lump, you go to your healthcare provider. They will give you the more details to it. At times it may not even appear to be milky or any color, but it may just give a discharge. So it's something for you to just go for early detection.
As long as you have a discharge, while you're checking, you go and...
If you've seen the discharge and there's a lump, so you go to your physician and you do a checkup. Okay. Then they will guide you through and they will reassure you if it's just a discharge or if it's tending to something.
Okay. So from what age do we start to check? From when one starts their period?
Provided you have breast tissue. So when the breasts come, in the young girls, at times these lumps are normal. Yeah, so that the major reason why we say immediately after the periods, because then the hormones are low. At times these tendencies come up towards ovulation because of
you can just have a lump
because of the increase in estrogen. So the lumps at times may dissolve, but when you're detecting it here at the time when estrogen is low, then it may be communicating something.
Okay, so we know that men hardly have estrogen, right? They have very little. So how come they are also predisposed to, like they can get breast cancer?
Men are predisposed to breast cancer because still of the exposure to these false estrogens that we have seen. So when they have constantly high amounts of estrogen in their bodies, because of the exposure to the false estrogens from the environment, it can lead to that. So their amounts of estrogens are supposed to be low.
Okay. So what kinds of products do they expose themselves to, apart from the perfumes and the diffusers and scents and gas scents and the plastics? What products can men be using that might have ingredients that
lead to this? Or the products are not specific to men, because also as we are using them, the animal products, the residues from pesticides that are used on the products we are buying. You notice when you go to the market, the tomatoes are almost white. So those products that are used to, like the pesticides, the residues, that we get from the pesticides. Then the other things that are used in production of, like, there's a growth hormone that's used in dairy, in animal,
Are they like
the
steroids?
eggs, close to steroids, because there are many hormones that are steroid in nature.
Okay.
Yes. So those different products, farm products that are used, growth products that are used in the farm produce. So we are all exposed to them on
So we have
a
to
daily
be careful
almost. Yes.
when we are buying our produce.
We can be careful, but the power that we have in our hands is how we handle these products when we get them.
How should we
So
handle?
like the tomatoes that you've bought, or the green pepper and all these things, you wash them properly. You can add a little bicarbonate of soda to help neutralize out these things. Then for the tomatoes, you wash them properly and you peel out that first cover, the peel.
Okay.
You take it off so that you're limiting the amounts that you're taking in on your dining table.
Okay. Since we're not going to stop using perfumes, honestly, we're not going to stop using air fresheners.
True.
We're going to still buy food from the market, and we have probably consumed these ingredients that are dangerous. How is there anything we can do? Can we eat something? How can we detoxify?
So the good news is we can detoxify. We can use the antioxidants, but then they are these very foods that we are getting, that we are buying. Yes. So we are going to support our liver through detoxifying, but with the foods.
Okay.
Now, which particular foods are we going to use? The vegetables. They are very good.
So greens, broccoli, cauliflower.
Yes. Now that bracket of cabbages, broccoli, cauliflower is really good to bind the excess estrogens in the body.
Okay.
Yes. So they are best when taken raw or half cooked, because the body does not absorb fiber from them when they
cook to nonsense. You know, I keep telling my house helps, you finished the knowledge in the vegetables, like they're now empty. Yeah.
So when consumed raw or half cooked. So when you're consuming them raw, it's better to blanch them. You just dip them in some hot water
for a few minutes and then
you take them out. So if you're choosing to cook, do not overly cook them. You half cook, then you serve. Other foods that are really beneficial for us across the menstrual cycle, the apples and the carrots. They are very good antioxidants. They will also help to absorb out excess estrogen, but also bind any other toxins that could be in the body. So you can consume them raw, you can consume them in a salad, you can consume them in a juice.
Okay. I don't think we've broken down what ingredients we need to look out for in products, like when we're buying products, and so that we make sure that we're not buying products that are going to
cause us harm. No. So when we are buying products, we have to pay attention on the ingredients. The major ingredients are 3 that have been FDA now banned or that have been put out. There are parabens. Now these are available in our shampoos, the hair products, the deos, the foundations. So you look out for the parabens. You look out for you look out for the phthalates and also aspartame. Now aspartame is a sweetener.
Parabens, phthalates, and
aspartame.
Aspartame.
Aspartame is a sweetener. It's in the most of the powdered juice, powdered concentrates, and the little sweets that we are buying for our children. So you look out for it. But if you've not looked out for these different products, we know that you can go on the nutrition side and you detoxify the body.
So eat all the cabbages, broccoli,
eat carrots,
lettuce, carrots. What else did you say? Tomatoes?
Tomatoes are also good. Majorly, the vegetables are good for detoxifying, and the fruits are good they have antioxidant properties and anti-inflammatory.
Okay.
Yeah. So when you're measuring on those two, that's the nutrition side. But also when you exercise the body, it increases metabolism and these things are burnt down and you can sweat them.
So exercise.
Yes, exercising is really good.
Okay. And then if say someone's mom or grandmom had breast cancer, and now you're trying to prevent them, you as a child, like you already know that it's probably in your genes. Are there things that you can do that
can help you? Now on the genetic part, there are different genetic stereotypes that are looked out for when you do certain exams. Now these exams are advanced. So once you know that you are genetically predisposed to getting breast cancer, you can choose to walk a journey with your gynecologist or your oncologist. You go and talk to them. Then there are exams that you do with them. And depending on what they find, then there they can advise you on what to do better with managing your metabolism to prevent the breast cancer.
Okay. Okay, then I'll just ask, how often and at what age should someone start doing like a routine mammogram, a routine, what's it called? Pap smear.
Or routine mammogram. These are things that are annual.
Okay.
Yes. But one thing on the pap smear, if you've done a pap smear and you're sexually active, if, let me say you've gone today, give it about a week before you engage in sexual intercourse. So at this part where they've picked the whatever
The
can
sample.
heal, where they've picked the sample can heal.
Oh, okay. And then a mammogram, at what age should someone even start getting a mammogram done?
Personally, I would say around when you hit puberty, 16 years and above, you can start going for a routine annual mammogram. Yes, you can do a routine annual mammogram.
I've never had one done.
Oh, we are
I'm not
all
16.
culprits. We are culprits. So if you have...
So this is just the ideal. Ideally,
yes,
by 16, you should be getting an annual mammogram.
You can go and do, but even before 16, if you notice you're getting lumps and you notice there are other tendencies that are happening within your breasts that you don't understand, you talk to your parent and then you go to visit your healthcare provider for further examinations to be done.
I've had things like people who give birth early don't, like the chances are lower. People who breastfeed, people who don't breastfeed are more susceptible to it. Can you demystify all those myths?
Oh, so now on the thing of giving birth early, estrogen is majorly triggered to be produced from the uterus. So when we are out of eggs, the body will stop producing estrogen. That's when we hit menopause. So where we talk of people who have started to give birth early, as women, we are born with all the eggs that we will ever have. So you start like, can I say, you start withdrawing from your egg bank.
From your bank.
Early.
So it's now less.
So you will have less eggs. You're most likely going to hit menopause early and you may not have these.
Oh, when you give birth early, you likely hit menopause early?
If you give birth early and you have little eggs, menopause may come early.
Okay.
So the thing with breastfeeding, when we are breastfeeding, we suppress another hormone. But now, more to do with breastfeeding is like you've given birth, the body has triggered the breasts to produce milk. So when the breasts are being triggered to produce milk, there are certain changes that will occur within the breast. And when the baby is suckling the breast, then we are can I say it's a natural process that we are facilitating to take place. But when we have given birth and we have not facilitated this natural process to take place, then the breast tissue will behave a certain way. Then when it's exposed to estrogen, then lumps may form out.
Okay. Okay. So you would advise that wherever possible, if you can, you breastfeed.
I would say not specifically breastfeeding, but have the milk expressed out. Whether you're using a breast pump or you're using a manual pump, provided that like there's that excretion of the breast milk.
Okay. Since hormones, estrogen predisposes us to breast cancer. What about birth control? Because these birth control methods have hormones. There's this one in the arm, there's a pill, there's the IUD that has hormones. So,
so a lot of stigma has been put around birth control, but birth control is not really bad. That's why we advise that if you're choosing a certain birth control method, you go and first discuss with your healthcare provider. So before you get a particular birth control method, hormonal or non-hormonal, but majorly on the hormonal side, your healthcare provider most likely will ask you all these questions. But if he has not asked you, that's why we encourage women to know these things and to ask these questions when you go to your healthcare provider. So on the breast cancer part, if you are already predisposed, if you are a smoker, if you have the genes, if you're genetically predisposed, your parents had this thing.
Or your grandmom.
Yes. So your healthcare provider most likely will not recommend you getting
the hormonal.
It could be hormonal, but a hormonal that is predominantly estrogen. Yes.
Okay. Now you know what questions to ask your doctors.
Yes.
Don't just get birth control because my friend is using the pill. It has worked for her. I have to get this one.
Yes. So we recommend that you yourself, you are equipped with enough questions to ask this healthcare provider because of the patient load and also personal problems. When you come and you're like, oh, I would want this.
I want an IUD, the hormonal one.
But the hormonal one at times may not be given to you because you've asked for it. Most of the people that are prescribed to the hormonal IUD or these hormonal contraceptives at times are used as medication. So for people who have suffered
acne,
but also gynecological conditions,
hormonal imbalances
to do with hormones, you may be prescribed hormonal contraceptives to manage those particular conditions.
Yeah. So even if you're on the birth control, say the doctor says this is okay for you, at least you've given us like foods that we can eat that will
support your body and help your body to detoxify. But then also you are aware of where you're getting excess of this. If you're using a contraceptive that has excess of the estrogen, that is mostly estrogen dominated, you know what to do.
Thank you, Lucy.
You're welcome.
I have learned so much. I'm going to eat a lot more cabbage and broccoli and veggies. I hope you guys have also learned. And breast cancer, the saving grace is early detection. So make sure you do the monthly check with your breast. You can do it at home by yourself. And if you have any red flags, please see a physician. Early detection saves lives. And if you have any questions, leave them in the comments. Dr. Lucy will be there to answer all your questions. And we shall see you again, same time next Thursday. Remember, we are rooting for you.